Okay, so any questions, concerns, comments about anything we talked about, some measurement issues or anything? Anybody started working on their evaluation plans and have questions? Everybody's like, yeah, I started that. So, okay. So tonight we're actually going to talk about planning your program evaluations. So we'll kind of go through, like, if you had to write an evaluation plan, like here's what you would have in your evaluation plan. And the plan is going to be based on the CDC framework for program evaluation, which we talked about at the beginning of the semester, and we've talked a lot about how what we've done to this point fits in here. So, you know, the describing the program comes from HED 720 in your program plan. So focusing the evaluation, we spent a lot of time talking about the different levels of evaluation, the gathering of credible evidence. We really talked about that more from the standpoint of the measurement issues and looking at threats and biases that impact validity and reliability. Justifying your conclusions is basically going to be your data analysis class. So if you're doing qualitative research methods and you're doing qualitative, then that'll come up in there. If you're taking biostats, whether it's biostats 1 or intermediate biostats, then that comes up in there. And then ensuring use and sharing your lessons learned. We'll talk next week about dissemination of your evaluation results. We'll talk a little bit about it tonight in terms of your plan, but actually going through and talking about how you can disseminate your results. We'll talk about that next week. So the next 2 slides are kind of just an overview of the evaluation plan, and we'll talk about each section as we go on. So you're obviously going to have an introduction, stakeholder assessment, background, program description, focus of the evaluation, credible evidence, your data collection. So, you know, in terms of thinking about the evaluation plan, in terms of thinking about, you know, who, what, how, when, and where, and your the CDC framework, all of these sections really kind of reflect those. So then the next sections are justifying your conclusions, so your analysis and your implementation, and then ensuring use and sharing lessons learned, so that reporting, that dissemination piece that we'll talk about more next week. So, talking a little bit more about the introduction. Your introduction is going to provide background information, identify the purpose of the evaluation, and provide the roadmap for the plan. So if you think about it, excuse me, from the perspective of, a research project or research paper, and you're writing the introduction or the introduction that you wrote for your program plan, it's kind of that same thing. It gives that overview of what your plan is about. So you're going to talk about your evaluation goal. So kind of what is the purpose of the evaluation? So in terms of, maybe it's laying out what your funders are saying, the purposes of your evaluation, providing that scope, so that it might be that some of the things that you're going to be, potentially evaluating may not be something that somebody else would have evaluated. And so it's just kind of explaining all of that. And then talk about who your evaluation team is. So who's going to be the coordinator for your evaluation? Who are the members of your evaluation team? So your coordinator is going to be like who's the lead person, who's kind of overseeing everything. And then your team members are going to be kind of anybody who, has a significant role in the evaluation. So people who might be collecting data or doing your observations, people who are helping analyze your data. You just kind of want to acknowledge everybody there. In some cases, you're going to want to put, indicate degrees. So if people have an MPH or they have a PhD or DRPH or whatever, so that people who are reading the evaluation results now know whoever did the evaluation is qualified. Okay. And that's really, the big thing there. It's not to, brag about, I'm Dr. So-and-so, but it's really more about, just kind of showing that, the people that are doing the evaluation have the expertise to do it. So you're going to have this introductory section, 3-4 paragraphs, probably minimum, and it may be a little bit longer, it may be a little bit shorter, it just kind of depends. But usually it's 3 to 4 paragraphs, maybe a little bit more based on, what you're trying to introduce as a part of the evaluation. So maybe even in here you talk about, for example, if you're coming in for the evaluation and you're an outside, what we call an outside evaluator, so you're not a member of that organization, and there's something funky about the way that you came in, like you're coming in after the project has already started, or something like that. So you kind of want to give that background for here's the context for the evaluation. Then you're going to go into your stakeholder assessment, okay? And remember, your stakeholders are going to be those people who have a vested interest in your program. And it might be that you work with the program planners to identify those key stakeholders. So you're not going to be trying to, talk about everybody who might be a stakeholder here, but really those key stakeholders that you're talking about. So there, involving your stakeholders, like with planning, if you involve them in your actual evaluation, then that's going to help increase the credibility of your evaluation. So it's going to help people, kind of believe in, understand your results, and go with your results. And it also helps to ensure that your findings are going to be used. So if people are in on the planning of the evaluation and they're stakeholders, then they can also make sure that whatever you're doing for the evaluation reflects what the needs are of the program. So you're going to identify who are the stakeholders for your program, who are those key people who are invested in your program. And so you might have like primary stakeholders and then secondary stakeholders. So, and you're really trying to target those primary stakeholders. You're gonna talk a little bit about what their interests are in your evaluation. And then talk about what role they play in the evaluation. So some of it might be setting the direction, some of it might be helping with the data, some of it though could be, just in terms of receiving and reviewing the results. And then you could talk about how do you plan to engage your stakeholders? How do you plan on involving them in the evaluation, whether it's in the dissemination piece, it's in the actual doing the evaluation, or it's in planning the evaluation, okay? And sometimes you need stakeholders helping you with developing your evaluation tools, okay? So your surveys, they might, be reviewing that, or maybe they're conducting your focus groups, or they're helping you collect the data because they, have relationships with the community and things like that. So really, in this section, you could do like a table with, say, 2 or 3 columns. So you could have like an actual person's name, and then in the next column be the organization, or you could put that in the same column, instead of putting it into separate columns. And then in that third column, then talk about what is their role in the evaluation and what, kind of why are they here. So that people kind of know that you aren't just planning this evaluation to go sit on somebody's shelf. That you're, planning on sharing this information, and here's how these people are going to be involved in the implementation and dissemination of your evaluation results. So then the background and description of your program, again, that comes from your program plan, or that comes from your grant. Here's what we said we were going to do, and so here's the description. So you want to make sure that your stakeholders have that shared understanding of the program, and if there are any unidentified assumptions or gaps, making sure that they help you identify those. Okay? So if you're part of the team that helped plan the program, you may know some of this already, but if you're coming in now as the evaluator and you weren't involved in the planning piece, then you may want to, check with the stakeholders about what are some of the assumptions. Why are you guys doing it this way? Okay? Because sometimes things are done because so-and-so said, well, this is how you access the community, or this is the way you need to ask this question or talk about these issues. Okay? So you need to also address the needs. So kind of what problem does the program address? So kind of what is it that you're doing and why is it that you're doing it? What are the causes and the consequences of the program, the magnitude of the program, and what changes or trends impact the problem. So all of these things about the program. So if you think about your program plan, a lot of this information would be there. If you're thinking about your grant, a lot of this information would be there. So some other information that you're also going to look at for your background are going to be context. So in terms of environmental factors that affect your program, kind of what's going on there. Okay, an obvious key one is going to be your target population. So who's your target population? Does your program target the concerns of one population? Who is it that you're trying to reach? And then your program objectives. So in terms of what objectives have you set out for your program? And again, thinking it through your program plans, all of this information is there. Okay? So, and then we've talked briefly about stage of development, but the stage of development is very important because if it's a new initiative, then you want to do more process level evaluation and making sure that you are implementing the intervention as it should be and that you're doing that okay, as opposed to something that's going to be more well established, where you've been doing the same thing for a while. Now you might be focused more, you're still going to do the process level stuff, but you're also going to be more focused on more of the short-term or long-term outcomes. So in thinking about, like where your organization is and doing this particular kind of work, you've got to figure out where you are in that cycle. Are you more, this is something new, or is this something you guys have been doing for a while? Because of the impact on evaluation. You're also going to look at resources that are available to conduct the program activities. Okay? It should be kind of obvious that if you have limited resources for doing your program, that can have a significant impact on your ability to get things done. And so, that would be reflected in your process level evaluation. You also might look at you talk about the activities. So what is your program staff doing to meet your program objectives? So looking in terms of like the intervention and what's actually being done. Are there things above and beyond the intervention that are being done? Describing those things. Things that you have to put in place first, like training people and so on and so forth, making sure you've got those resources. Talk about all of that in terms of your background. So your outputs are going to be what are the direct and immediate results of the program activities, so in terms of materials produced, services delivered, etc. Okay, so if you look, for example, and again, because part of this reflects that CDC framework, if you look at a lot of the logic models that the feds have, they have that column for your outputs, which are these kind of immediate things that you're going to see as a result of your program. And then you're going to have your outcomes in terms of the intended effects of your activities. So what is it that you ultimately hope to accomplish? Okay? And on some level, these are going to be reflected in your objectives. Okay? They're not going to be anything kind of new that you have to come up with. They're really kind of reflected in your objectives. Okay? Or if you think about, when we did the tables and talking about, like what we would be evaluating, and we had the your objective, and we had the evaluation questions and the indicators and the source of evidence. We also had that logic model outcome. That's what this is, okay? So, all of this is information that you have in your program plan, that you have in your grant application, that you said this is what we're going to do. And so it's just a matter of pulling it into your evaluation plan. Not always necessarily a direct cut and paste, but more of, a summarized, synthesizing that information. Okay? So then the next section, you're going to talk about the focus of your evaluation. Okay? Because it's not always going to be feasible for you to evaluate everything. So you're going to have to prioritize and select your evaluation questions. Yes?
Is this done solely by the evaluator or in conjunction with the stakeholders?
Usually, and actually it takes us to the next part of the slide, it's done in conjunction with the stakeholders, or, so if you're coming in as the external evaluator, you would have those discussions with the organization that you're doing the evaluation for. So, part of it is the focus is going to reflect on stakeholder needs. So like obviously if it's your funder, you're going to want to address what their needs are. Okay? But you're also going to want to consider other people as well. So in thinking about like stakeholder needs, you'd be looking at who's going to use the evaluation findings. How will the findings be used? So are they using it to advocate for more money? Or are they using it to show this is why they need this program? Or the flip side, are they going to potentially use this to say, we don't need this program anymore? This is always a possibility. Or, they want to show how cost efficient your program is and that you're actually making a difference. And then what do your stakeholders need to learn or know from the evaluation? So kind of, is there certain things in particular that they want to know? And your funders, a lot of times, will be able to tell you that. They'll be able to say, all right, here's the information that we need, and here's what we want. On some level, this is why we need it, okay? So sometimes if you're a part of high-profile projects, or funding initiatives through the federal government, they're reporting that information back to Congress, okay? So obviously they're shaping what it is that they want from you based on what they need to report back to Congress or what they need to report to other people. So, kind of keep that in mind. Like sometimes you might say, well, that doesn't make sense. I don't know why they want that information. But it might be that they're reporting some of that back to Congress. And in some cases, so if money is distributed across the U.S., they might not just give one big, massive report to Congress, but they may also give information to your state congressional delegation. So they're giving that information to them as well. So that's why they're asking for different things. Okay? You also, if you're focused on process monitoring, process evaluation, then, thinking back to what those levels of evaluation are, these are the things that you would be looking at. Okay, so, you know, think about some of this too, particularly at a process level of not only just documenting what you did, but also looking at it, documenting here's what we plan to do and here's what ended up happening. Okay? And so then it might become that you need to document here's why we did certain things or why we didn't do certain things. Or here's why the plan worked or why the plan didn't work. Okay? It's not just enough to say, oh, well, you know, we're looking at this to see whether or not we followed our plan. You may have to also be looking at why didn't you follow the plan in terms of your process monitoring and your process evaluation. Or, you know, it's not just enough to say, oh, well, we were going to be in 100 schools and now we're only in 2. You know, realize at some point, especially if somebody's giving you money, they're going to want to know why you weren't in these things. Okay? So yes, you're going to be, you know, kind of documenting that process stuff, but you also, I can tell you, are going to need to say, here's why you weren't doing certain things. If you're going to be doing outcome monitoring, outcome evaluation, then obviously you're going to be looking at whether or not the program produced the intended outcomes as well as progress towards your goals and objectives. So, you know, we've talked about all of this all semester, so it's really just a matter of thinking it through and putting it into a plan and talking about these are the things that we're going to be looking at. We talked about writing evaluation questions. So as we did examples this semester, we did them at the process level, we did them at the outcome level. So, you know, you'll have to have those kinds of evaluation questions. And again, reflecting not just in general, this was what sounds good, but then what's the need of the stakeholders. So, if, you know, if the program itself is the primary stakeholder, then what are the needs of the program? Look then at the assessing your questions. So figuring out, is it going to be feasible to collect the data that you need to answer that question? And will you be able to provide accurate results? Okay? And so remember back when we were doing the tables and we were saying, here's the objective, here's the evaluation question, here's the indicator, here's the source of evidence, and there were times when we were like, well, our question doesn't quite reflect our indicator, and so on and so forth. So, really taking a keen eye and looking at your evaluation questions to make sure that they're right in what you need, okay? The other thing that you're going to look at is evaluation design. So one of the things to think about in terms of evaluation design, key point, is you don't have evaluation design at a process level. Remember that? Some of you are like, yeah, some of you are like, no. But remember, evaluation design looks at whether or not your intervention caused the changes that it did. Okay? So you're doing that observation before, then you're doing the intervention, and you're doing that observation after, or some form of that design. That doesn't have anything to do with process level stuff, with the actual implementation. That's looking at changes in your outcome and in your impact, okay? So in those short-term and those long-term measures. So if you put in your evaluation plan that you have an evaluation design to do process level monitoring or evaluation, that's going to be absolutely wrong. Okay? So in other words, don't do it. So you have to think about, in terms of evaluation design, can you have a control or a comparison group? Okay? And we've talked about this during the semester. Sometimes you can, sometimes you can't. Okay? Where you can, you try to as much as you can. You also have to think about, when will you collect the data? Okay? So if you're doing a time series design and you're collecting immediately post, then when are you collecting that data after that? Are you doing 3 months, 6 months? Are you doing 30 days, 60 days, 30 days, 90 days? Kind of what are you doing? And if you're doing a time series, are you collecting data at multiple points before the intervention? And what are those multiple points? Okay, so you got to think about when you're going to collect the data. You also have to think about, will data be collected retrospectively or prospectively? Okay? Ideally, you want to do things prospectively, but sometimes you get brought in after a program has been already implemented, or they've already started implementing. And so now you've got to look back retrospectively. But just remember, there's only so much you can look back at retrospectively. And take into consideration who your target audience is and how far back you want them to go. Okay? So if you're dealing with kids and you expect them to think back to last year, it's not going to happen. Okay? Adults struggle thinking back to a year ago. Okay? So keep that in mind, retrospectively, prospectively. Ideally, we want to do prospectively. Okay? If you have to look back retrospectively, so like let's say you want to say people's blood sugar levels rose. Obviously, you can't go back in time and take people's blood sugar. But maybe, okay, we don't have that technology yet. Okay, I'm just going to put that out there. We don't time travel yet. But maybe you have access, or the program has access to charts where you can find that information early on. So you may have to be thinking about, if we're going to have to look retrospectively back at something, maybe we're not talking to the individual, we're going and looking in a chart, or we're looking in a file, and we're finding that information. Think about the kind of data that you need. Okay, is this quantitative data? Is it qualitative data? How rich do you need the data to be? How much data do you need? All of that's here in terms of the type of data that you want. Is it okay just to have counts of, this is how much somebody was doing something? Or do you need a little bit more detailed information? And think about what data you have already. Okay, I think a lot of times we get caught up in, we've got to do this data collection and we've got to do that data collection, and it becomes a matter of, well, particularly if you're dealing with a clinical situation, there might be data already in the charts that you don't need to go look at. So think about it from that perspective too. Or if you're comparing communities, then the epi data for the most part generally exists, and you don't have to go out doing these massive surveys to find out whether or not people have been diagnosed with something. The epi data already will exist a lot of times for those things. So think through what data you really need to collect and what data you don't need to collect, and then what data you already have that you can deal with. Some other things in terms of focusing your evaluation, particularly when it comes to designs, like, are there standards for good evaluations? Okay. Yes, we would all like to have a control or a comparison group, but does that really fit with what it is that you're trying to do? So another thing to think about again is timeliness. How much time do you really have to do the evaluation? How much time do you have to really collect the data? And where does that all fit in the overall program timeline? Yes, it would be great to do a time series and to show that people are maintaining these behaviors months afterwards. But you might not have the timeline to do that. Okay? So you have to take that into consideration. Again, stage of development becomes very important. You may want to, if this is your first time implementing an intervention and you're, being told to look at outcomes, you may not want to bring in a control or a comparison group initially, because again, you're still learning all of this and you're still trying to figure it out and make it fit within your organization. So you may say, we're kind of still in the early stages of doing this, so we don't want to bring in these additional people, or if you're just developing your data collection tools, you may want to try them out first before you actually go implementing them. Another thing to think about is the data that's needed, kind of, what data is needed for your project. What are the things that you need to know? What are the things that you don't need to know, etc. In terms of strengthening your design, so in terms of strengthening that evaluation design, mixed methods now is kind of like the way to go as much as you can. So doing some quantitative data analysis or quantitative data collection and analysis, but also doing some qualitative data collection and analysis. Okay? Sometimes not always feasible. Okay? For some community-based organizations, doing mixed methods is not feasible. It just doesn't happen. On the other hand, if you're working with a university and maybe you have a graduate student who's getting their project from whatever it is that you're doing, then doing mixed methods might be a little bit more feasible because you've got somebody who's got the time and the expertise and the motivation to get that work done. Using repeated measures, so doing like a time series design obviously strengthens what it is that you're doing, particularly repeated measures post-intervention. If that works, if that's feasible, it may not be feasible, so don't feel like you have to do it. Triangulate the data. So basically, with triangulation, you're looking at a situation from multiple angles and you're saying kind of this is what's going on by looking at it from multiple perspectives and not just looking at it from one perspective. So you may have qualitative data, you may have quantitative data, you may be using existing data as well as data that you're collecting. And you may be collecting data from a lot of different sources to kind of build that picture of what's going on. And so that's what triangulation means. Okay? So once you've kind of focused down, so whether it's just the general, here's the focus of our evaluation, or you're looking at the design and said, okay, here's the design that we're going to use and talk about when you're going to collect data, then you've got to gather your credible evidence. So you need to talk about your data collection. So here's where you identify your indicators, your standards, your data sources that are going to help you address your evaluation questions. So indicators, like what we talked about with the dashboard, are going to be visible, measurable signs of your performance. They're going to reflect your program objectives as well as your logic model and your evaluation questions. Okay. Another thing to look at here is going to be your program benchmarks and your targets. So in terms of the like kind of what are your reasonable expectations for your program performance, and then what are the benchmarks to which you're going to measure your performance against. So some of this is going to come from what have others found in doing your intervention. Okay? Those are going to be kind of like your benchmarks and your targets.
Those benchmarks are usually given already, right?
Yeah. I mean, for the most part, like, so if you're doing an evidence-based intervention, you'll kind of know, like, here's it. Usually it'll say in the research, or they'll give you like the citation to the articles about the intervention. They'll kind of tell you kind of here's the things that you can expect to achieve. And so then you can kind of gauge whether or not, you're ridiculously close, or, you're like completely out of bounds. And so then something might not be going right. And on some cases too, like your funders may set these benchmarks and these targets. So, like for example, when we had the Teen Pregnancy Prevention Project, they wanted, they counted successful completion as kids attending 75% or more of the sessions. Okay, so if you're doing 8-9 sessions, they've got to attend like 7 sessions. Like there's no ands, ifs, or buts about it. And then they wanted 70% of all of the kids that we interacted with or that came to our sessions to successfully complete. So they wanted 70% of the kids who came to complete 75% or more of the intervention sessions. And I think that was a number that was arbitrarily set by the feds. I don't think, somebody just said, 70% sounds good, and not realizing that in working with kids in the community setting in particular, or outside of a confined environment. So whether it was in, but even then, in juvenile justice, like yes, they're confined, they're there, but kids are transitioning in and out all the time based on what their sentencing is. The other place too is like with schools, so you can have a little bit higher participation in schools because kids have to come to school versus a community setting where they don't have to come. And in some cases, they don't control their own transportation, they don't control a whole bunch of other things. It makes it hard. And so we continuously did not meet that benchmark that the Fed set for us. What we also found out too was that a whole bunch of other people weren't meeting those benchmarks. So it wasn't like, we were the bad guys. It was just, I think it was just a bad target, a bad benchmark that was set, and they were just like, oh, well, here's what we want everybody to do. Some other things to think about in terms of the actual data collection. Okay? Think about where will the data be collected. Okay? If you're going to be collecting, sensitive information, so asking about drug use, asking about criminal behavior, asking about, in particular, STI, HIV, drug status, all of those things, not the kind of thing you want people to fill out in the open. Okay? So think about where you're going to be collecting that data. Think about what methods you're going to be using to collect data. So, for example, I just had a conversation with a student based on some work I did with another student. She was doing, she wanted to do an online survey, which is great because then, people basically enter their own data and you don't have to worry about anything. The challenge, though, is if we go to a classroom like this and she says, hey, I'd like you guys to fill out my survey, and she flashes up this QR code, or she gives you a card that has a QR code and a link, you may or may not fill out the survey. Versus if she came into the classroom and said, hey, I have this survey, would you guys fill it out? And she hands each one of you a paper copy of the survey, you're going to be more likely to fill it out. Okay? So thinking through those kinds of things. Even one of the things that I want to try is this computer assisted surveying. So there's actually software out there that you can put it on an iPad or have it online, have the survey online, and you can give somebody like the iPad with headphones, and it'll read the survey to them, and it'll read the responses. So if you have a low literacy, maybe English isn't their first language, then that's a way of getting people to actually fill out the survey. Or if you're asking people sensitive questions in a waiting room, for example, so that they don't have to worry about somebody hearing somebody read the question to them and then everybody goes, what is the response? What'd you say? Kind of thing. If it's in the headphones, nobody can hear it, and so you keep moving. So thinking about, like what methods are you going to use for collecting the data? If you're going to be doing focus groups or interviews, thinking through all of that, because you got to now have audio recording so you can record what's going on. Think about how often the data will be collected. So, pre-intervention, post-intervention, how many times, is there going to be any data collection during the intervention? Okay, because maybe you want, like we do course evaluations, for example, at the end of the semester. But maybe we should be thinking about doing course evaluations like mid-semester and then at the end of the semester. So then that way, an instructor could get feedback on whatever it is that they're doing, etc. Who will collect the data? Okay? So, sometimes there's, certain requirements. So I mentioned the course evaluations. Us as faculty, we cannot collect our own course evaluations. Okay? I know sometimes that does happen. I'm just gonna put that out there. I'm not completely ignorant. I know some faculty have collected their own course evaluations. They are not supposed to. It's supposed to be, somebody else from the school, like an administrative assistant, who's doing the course evaluations. We talked about, when we were talking about like response biases and things like that, and things that impact measurement, validity and impact measurement. If like you have a mixed gender situation where you have men who are now telling a woman whether or not your woman is the data collector, whether or not they use a condom. If she's cute and she's young, they might not answer as truthfully because they're like, trying to impress her kind of thing. Even, we see that even too, like with older people and young kids, like, they aren't going to want to answer truthfully sometimes because they don't want the other to know what's going on. So think about who's going to collect the data. Tools for data collection. So your actual surveys or interview guides, etc. Okay? The big thing is collect the data that's needed. Okay? Don't go collecting a whole bunch of survey stuff like, ooh, we got these people. Let's get everything that we can get from them right here, right now. Because people aren't going to, first of all, they're not going to want to fill out a long survey. And then, if they're smart enough, okay, and usually there's that one person in the bunch, they'll say, well, you said you were only asking us about HIV prevention. Why you got these food questions on here? What does that have to do with anything? Kind of thing. And then people get turned off by it. What are you doing with my information? Make sure that your data collection tools are easy to administer. So from a staff perspective, make sure that they're easy to give out, and make sure from a user perspective, they're easy to use. Okay? So, wherever you can, make sure that if you're doing a survey that you've got skip patterns, so if things aren't relevant to somebody based on their answers, that you're skipping them through, making sure that's very clear in your survey, okay? So that people can easily follow. If you're doing something that's going to be a paper survey, okay, 10-point font ain't cool. You may even want that itty bitty font or font that's very hard to read ain't cool. Use something that's very easy for people to read. And in some cases, consider going 14-point font so that it's very clear. Use underlines and bolds and italics so that people can see where, like the instructions maybe are in bold so that they know, oh, I should attend to this. I should pay attention to this. So And sometimes, you know, the only way that you know this is either through experience or through giving it to somebody and asking them to fill it out. Okay? And particularly somebody who reflects your target population. Think through too about language. Okay? So if it's going to be in English, reading level, how, you know, can somebody easily read this? If it's going to be translated, make sure you get it what we call forward translated and backwards translated. So forward translated means that somebody takes the English version and translates it into the language that you want, and then backwards translation meaning somebody then take that instrument that's in a foreign language and then translate it back into English to make sure that it reflects your target population and it gets across what it is that you are meaning. And know that for some people from some countries, for example, there may be multiple languages spoken. So you need to be aware of what language are you getting it translated into and how might that work. You know, sometimes it doesn't work very well. Understand that there are some populations, I want to say the Hmong from Southeast Asia, that have really only had a written language for like the last 50 years. So now if you're talking about elders in this population who may be 70 years old, they may not read in that population, and it's not because they're illiterate, it's because they didn't grow up learning the written language. So think about it from that perspective. So you got to take all of this into consideration when you're writing up your data collection and what it is that you're going to do. Okay, so we did a lot of this semester, so you're going to link your indicators to your data sources and specify your data collection plan. Who's going to collect the data? When are they going to collect the data? How are they going to collect the data? So when you talk about the who, for example, it may not be a specific person. It may be project staff, or it may be a nurse, or, you know, whoever is going to be doing the data collection and when that's going to happen. But in the how, refer to specific tools. Don't say, you know, oh, they're going to fill out a survey. But what survey are they filling out? Like, give your surveys names and say for sure, so that if you're doing the plan for the evaluation and now somebody else is going to be implementing the plan for the evaluation, now they have they have enough information that they can go implement it. Okay? They're not looking at it like this would be the recipe, but the recipe's incomplete. So you're just saying add some flour, some butter, some vanilla, some chocolate chips, and some sugar, and make some chocolate chip cookies. Okay? Give as much detail as possible so that people can actually make the chocolate chip cookies. Some other things around data collection is looking at human subject considerations. Okay, so here at the university, obviously we have IRB and we have human subjects. UMC, I believe, has an IRB, or they were in the process. Everybody's looking at Alex like, What do you know?
I don't know.
I know they were in the process of trying to establish one, and so I think they do have an IRB. CCSD, Clark County School District, has an IRB. So, know whether or not you've got to go through IRB. Even if you don't have to go through IRB, that is still no reason to just cut up and act a fool. Okay? I'm just gonna put that out there, that's no reason, like if you're like, oh, we don't have IRB, I don't know if I should do this, okay. 2 rules of thumb there, okay? If it's something you wouldn't do, then don't expect somebody else to do it, okay? So if you're asking people to, give 15 blood samples and a urine sample and you wouldn't do it, then don't ask somebody else to do it. Number 2, and probably just as important, if not more important, if you're not willing to defend whatever you did in the court of law, then don't do it, okay? Because people are sue happy, and they will sue you if something goes wrong or they perceive something goes wrong. So if you're not willing to defend that, then don't do it, okay? So, you should always make sure you maintain your CITI training, your city training on human subjects. If you don't have it, get it. That gives you some background on kind of a little bit of what it is you can and cannot do, and kind of the thinking of IRBs. But as much as you can, to protect yourself, I would go through IRB. So that might mean, like here in this state, we don't have like a statewide IRB. So when I was living in the state of Florida, they had statewide IRB. So if the health department was doing a research project, it went through the statewide IRB. We don't have such a beast here. So if you're here and you want to do research, partner with somebody at UNLV who can run it through IRB. It just kind of helps to protect you in the long run. Also think about your evaluation timeline. So remember in program planning, you had to do a timeline. So you would do a timeline for your evaluation. And part of what that timeline is for is to help you see whether or not you're going to have a strain on your resources because you've got multiple activities that are going on at once. Okay? And if, in laying out your program implementation timeline and then your evaluation timeline, if you see that you've got too much activity going on at a certain time, you may have to shift kind of when you're doing some things, just because you don't want to strain your staff, your resources, etc. Also make sure that your stakeholders are going to be aware of when activities are occurring so that they can make sure that if they need to be in place or they need to be doing something, they're available and can do it, as opposed to just popping up in, one day and saying, oh, by the way, you're supposed to do blah, 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 evaluation isn't always something that people want to participate in, so you want to give people some kind of notice. The last thing around your data collection to think about is data management and storage. Okay, so think through how you're going to manage your data, how are you going to store it, make sure that you have confidentiality in terms of your data quality, etc. Okay, know what the expectations are in terms of keeping copies of your data. Okay, and in terms of the feds, oftentimes their expectation is you keep your data 3 to 5 years after that project. Okay, so if you're doing pencil paper surveys, you've got to have access to locked file cabinets that you can keep this data in even after the project is done. Okay, so make sure, so if you're doing it, a project here at UNLV, make sure that even if you leave, that data is still available. Okay, either it has to be maintained here at UNLV or you have to maintain it somewhere wherever you're going. Okay, and that's very important. Obviously, what's his name? Zuckerberg was on Capitol Hill today and I guess part of this week talking about Facebook and, their data confidentiality issues. This is a very real concern. If you're dealing with mailing information, think about who has access to the mail and who has access to that information. If you're asking people to fax information into you, who has access to that fax machine? Is it the general one in the department, or do you need to get one specifically for that particular unit? In terms of storing data, sometimes it's not good enough to store data on Google Drive. It needs to be on hard drives. It needs to be on computers. Your computers need to have be password protected. If you need to have password protection on, the actual files themselves on the computer, then you need to make sure you do that. So it's a lot of different things that you've got to think about. Managing the data. You're gonna collect data, and it's gonna be entered in online, whether it is qualitative or quantitative. Okay, because if it's qualitative, you're probably going to have transcripts typed up, and you're going to have to review those transcripts and make sure that what's in the audio recording reflects what's in the transcript. And, in terms of confidentiality, your transcriber is going to have to sign confidentiality agreements. And it may be that, in the interview process, you don't actually mention the person's name of who's actually being interviewed, so that you can help, again, maintain that confidentiality. If it's, qualitative data, even if it's entered into Qualtrics, you may still have to manipulate the data in order to be able to analyze it. So, you may have like a 10-item scale, and really what you're interested in isn't the individual items, but it's the score, the sum score of those items. So now you've got to go in and create those new variables. So you've got to understand how to do all of that. Some of this you can do in Excel, some of this you can do in SPSS, but you got to know what it is that you're doing so that you can manage and store the data appropriately. So, in terms of justifying the conclusions, your analysis and your interpretation. So, obviously, the analysis and the interpretation are going to help you understand what the findings mean for your program. So in terms of analysis, think about what analysis techniques you will use for each data collection method, and then who's responsible for the analysis. So I would even take this a step further and say, figure out what analysis you need to do to address a particular evaluation question. So if you're going to want to know if you address this evaluation question, or even if you met this objective, think about the analysis that you have to do. Okay? And then think about who's responsible for the analysis. Who's going to do your data analysis? Is that going to be you? Is that going to be, somebody that you hire? Who's going to do it? Okay? And let me just caution you, just because somebody says they can run statistics doesn't always mean, number one, that they're going to run them like you need them. Okay, first and foremost. So, those of you that I don't understand why I need to take this class, you need to know enough about statistics and enough about data analysis to be able to tell somebody this is what you need to have run. Okay? Then the other side of it too is hiring somebody to run your data analysis. I just was peripherally involved with a situation where, so you know how you run stuff in SPSS and you get this output, okay? Well, the person who ran the statistics only gave part of the information about the analysis and didn't give, the complete picture. So now, and this was actually a student who was doing a graduate project with me. Now, I'm like, you need some more information. And she's like, well, the person won't give it to me. I'm like, how the hell? Pardon my French. But how the hell does somebody run your data that you collected, run your data and not give you all of the results? So be very mindful of who's running your data and who's collecting your data. And if you know enough about SPSS that you can run stuff yourself, you can get books that explain to you exactly what it is that you're looking at, exactly what tests you need to run, exactly how to write it up. So, a challenge with getting somebody else to run your data sometimes is that they'll say, here's the output, good luck with that, and they won't help you write it up, not only in terms of the results, but in terms of the analysis that was done. So, try to learn enough that you can talk through with somebody about here's what I need run, here's, the steps that I'm taking and, why I'm doing this, so they can go, yeah, that's right, or no, that's not right. And that maybe you can go back to after you run the data to say, okay, am I interpreting this right? Because sometimes if you give people wholesale your data to run, you may not get what you need. And then that creates even more problems. So be very careful about who's responsible for running the data. Interpretation. Think through What are the conclusions you can draw from your findings? And then think about how will you involve your stakeholders in terms of making sure that everything is run correctly. So, and sometimes, you know, you may run the data, you may go to your stakeholders and say, this is what I'm seeing. These are the results that I'm getting. Does this look right? Does this make sense? You know, or is there something else that's going on? Do we need to look at this a different way? Kind of thing. So you really need to, you know, figure out, again, who those primary stakeholders are and say, here's what we're finding. So when, for example, when I was talking about the teen pregnancy prevention grant, and we were talking about who gets, we ended up having a conversation, like, you know, they're like, you guys aren't meeting your marks, your targets in terms of 70% of the participants completing 75% of the sessions. And so we had a conversation about at what point, so somebody comes to the first session, do we enter that person in as having come to the first session, or maybe they come to the first 2 sessions and then they drop out? Like, at what point do we enter somebody in the system and saying that they're a participant? Which, I mean, I was uncomfortable with that situation because I felt like we were kind of cooking the numbers a little bit. You know, like if we're saying, okay, well, they need to come to at least 5 before we enter them in the system, then, you know, that kind of felt uncomfortable to me. And then, you know, and it became, then it comes down to your process, you know. So it was like, okay, well, we upload our attendance data like every week. Well, if you upload it every week, then you can't keep track of, you know, okay, somebody came to 5 sessions, so now we can enter that. You know, it became, okay, well, then maybe we need to wait, you know, and not enter our data weekly. But then that becomes a burden for somebody when they finally have to enter that data, figuring out who are they entering, and, you know, so on and so forth. So you've got to have, you know, sometimes you've got to have those conversations like, what are we really doing here? What does this mean? You know, it also became very helpful when, you know, the Fed said, oh, well, you guys aren't the only ones who aren't meeting your attendance marks, you know. So you're kind of like, oh, okay, phew, you know, we're not the odd man out here. Everybody's doing that. So the last section in terms of your evaluation plans, and we'll talk about this more next week, is around reporting and dissemination. So you've got to come up with this plan for how are you going to disseminate your evaluation findings, how are they going to be used, so that your evaluation reports don't just sit on the shelf. Okay? Because too often evaluation reports sit on the shelf. So when we're talking about dissemination, you need to think about like what medium, what channel, kind of how are you going to disseminate your evaluation findings. Okay, I can tell you just writing a report is not going to be good enough. that you're going to need to think of other ways of disseminating your evaluation results. And then think about who's going to be responsible for the actual dissemination. Okay? If you're the outside evaluator that's coming in to an organization to do the evaluation, you might disseminate the evaluation results within the organization, but then other people within the organization may distribute those evaluation results to other stakeholders. So you may only be involved peripherally in terms of disseminating your evaluation results. Sometimes, a lot of times, people want to hear from actual participants. So think through, is it possible to have actual participants talk about, here's what we did, here's what I learned, here's how I improved my health, here's how I'm using this information, those kinds of things. Think through all of that, because that becomes more powerful than the CEO of the company or the organization who's never out in the field going around talking about the evaluation results. So think about who's going to do it and how you're going to get those results out. Then in terms of use, think through, how do you want these evaluation results used? So think through how, where, when will the findings be used? Think through who will act on the findings. Okay? So if, results need to go out at a certain time in order for it to be used in a certain time, then you've got to think through all of that and make sure you plan for all of that. Okay? You can dictate how things are going to be used. If you want, lessons learned, if you want it to feed back into planning, you can dictate that. If you want to talk to others about, here's what we found and here's how to use this, then you can do that as well. So it's really just a matter of thinking through some of that. And we'll talk next week about this whole dissemination piece and how you can go about disseminating information. So in terms of your evaluation plan, these are all the sections that you should have. And like I said, they reflect the CDC planning model. And a lot of it's all stuff that we've talked about all semester. It's now just putting it together in one document. So in terms of tips for your evaluation planning, so things to think about. One thing is start small. Don't try to evaluate anything and everything under the sun. You may have to look at a limited number of evaluation questions or one initiative or one program component as opposed to everything. Okay? Use what you already know about the program. Okay? So if there's already things that are being implemented, use that information, build on that. Like, don't keep reinventing the wheel. Where you can, use existing sources of data. So, and I'm going to take this even a step further. Not just existing sources, but also use existing data collection tools. Okay? So, I was just talking with some of my students today about, replicating for their capstone experiences, replicating surveys and studies that have already been done. So it's getting in touch with the author of that manuscript and saying, hey, would you share a tool with me? And in most cases they will. Or nowadays too, it's even Googling some of that and you can find the tool already there. So use what's already there. Don't feel like you've got to, develop everything new. If there's existing data, use existing data. If there's existing surveys, use existing surveys. Don't try to come up with something new all the time. Be realistic in your timeline and in your assessment of resources. So, data collection always takes longer than what you think, okay? Very rarely does it take less time than what you think. Even if it's, data collection in class, for example. You say, oh, this should take 5 minutes. And instead it takes 20 minutes, which may not sound like a big deal, but if you're in somebody else's class and they have planned on 5 minutes and now you're taking up 20 minutes of their class time, that can be a big deal. Just in terms of like numbers of people, and getting surveys and interviews with numbers of people, just know that it can always take longer. In some cases it can take more resources. Because it takes longer, it takes more resources. So recently we found that we had over 300 and some people access an online survey, but they maybe answered like the first 2 or 3 questions and then saw the rest of the survey and was like, I'm not doing that. So then we had to, so we had to have the resources obviously to be able to collect all this data, but then we had to go through and dump some of this information because they just didn't complete the survey. So be realistic about, like the resources that you're gonna need. Know that sometimes you might have to have pencil paper surveys. So if you have to have pencil paper surveys, now you've got to have copies, you need to have clipboards, you need to have pens and pencils, because not everybody carries that information around. And especially if you stop them on the street, they may not have it. So, and it always makes it easier for the person. I mean, you're thinking about ease of use. If you have that clipboard that's a flat surface that they can fill out, if you have a pen or pencil already there, that they're ready to go, you're making it easier for them, but that means you've got to have resources available for that. Use templates, tables provided as a guide and adapt as needed. So if your funding agency has certain reporting requirements and they give you templates and tables, use those. Don't be creative. This ain't no creative writing class, okay? They gave you those templates and those tables for a reason, and they want you to use them because that's probably, easily puts the data where they want it and how they need it. And so, if you're sending the report electronically, then they know they go copy table 1, and if your report, and they can go across the board. If you use something different because you decided, oh, I'm going to be creative, I don't really like that table, I don't like that template, then it creates a whole bunch of problems, okay? And in some cases, if your report has to get accepted first, your report may not get accepted. So now you're deficient in the programming and in your implementation because you didn't get your evaluation report in on time. Okay? If there's not templates and tables that are provided for you to use, ask. Most they can say is no. On the other hand, they might say, you know what, we really found we liked UNLV's tables and things, use that as a template. Okay, so it never hurts to ask if there are some. And then seek help with your evaluation. Okay. Don't be stubborn. Ask for help. Okay? Most times at universities, there are people who do evaluations who will consult with you in some cases for free. Okay? Or they'll answer some questions for you. So don't feel like, you're kind of out there on your own doing this and you're like, I don't know what I'm doing. Okay? Even asking your funder, ask them for help. They want you to do something, they should be able to explain it to you. Don't feel like, oh, they're going to think bad of me. You know what? Because you probably ain't the only one who has the same questions. Okay? If they have trainings on the evaluation, you should at least go the first time around. Okay? So that you can hear what it is that they want. And if they're changing something, ask what the updates are. Because again, this is what's required. So make sure you get the help. So in general, for a plan, for a program evaluation, at minimum, it needs to address process monitoring and process evaluation. So it needs to have that basic implementation stuff. And your evaluation plan needs to relate back to your objectives. Again, this is not a creative writing class. Don't set up program objectives that you did in your program plan and nowhere in your evaluation plan do you address those objectives. Okay? Because if you do that, nothing makes sense. Okay? And it becomes really an effort and futility what you just did. So always make sure that you relate your evaluation back to your objectives. Okay? If you find, again, that something doesn't make sense in your objectives, now from an evaluation standpoint, change it. But be very clear that you change this objective because now in reviewing, and coming up with the evaluation plan, it didn't make sense. And so, just make sure you say that. Don't expect somebody who has your original evaluation plan and now looks at what you're going to do and you've changed an objective. Don't expect them to say, well, why did you change that? They might say they don't know what they're doing. So always relate back to your objectives. And then identify your goals for your evaluation. What is it that you're trying to do? Okay? And most times it's going to be, fulfilling your funders' requirements. It's going to be documenting that you're meeting your benchmarks that have been set for you, etc. Okay? So, the last section, and I've kind of talked about this a little bit, is who are you going to call? Okay? So you can have evaluators that are within your organization, or you can have evaluators that are external to your organization. And each one comes with its own issues. So you've got, like I said, the internal evaluation, you've got the external evaluation, and this can sometimes be a review team. So this is a group of people who come in and do things all at once, or it can be an external consultant. Okay? So, somebody who comes in specifically to do your evaluation. Okay? And there's advantages and disadvantages to either one. So, internal evaluators, then some of the advantages is obviously they're going to be more familiar with your organization and your program. Okay, so if you're talking about internal evaluators, obviously these are going to be people who work usually directly with your program. So it makes them a little bit better. You don't have to go out and find anybody, and they're familiar with the culture of your organization, the culture of your program. They know what it is that you're trying to do, etc. Okay? They also know the decision-making style of the organization. So, in thinking about, using the evaluation results, now here's somebody who's internal to the organization who can help you frame your results in such a way that people will use them because they understand, oh, if you give Dr. So-and-so a whole bunch of figures and charts, he's not going to read it. If you give him bullet points, then he'll read it and then he'll act on it. Don't give him, a whole bunch of background information. Give him the recommendations. This is what they want. And then that can help you easily affect change if you've got issues that need to be changed, etc. Okay? The other part of it too is an internal evaluator is going to be around to remind people of the results. So your internal evaluator is going to be at departmental meetings, program meetings, etc. to say, hey, don't forget, this is why we decided to do this. Or, here's what we found, we need to be thinking about doing these things. Okay? So, people will, fortunately or unfortunately, see that person and say, oh, yeah, they're the evaluators, we've got some data to collect, we've got some whatever to do. And then they're also, because now they're around, they're able to communicate results more frequently and clearly. So because they're around, they can repeat things in meetings or make sure that flyers are being posted about, different results or talk about things more often. And if people have questions, they, other staff know that they can go and ask this person, what are their questions and get some clear answers and clarity when they're needed. A challenge with being an internal evaluator, especially if things aren't going well, is on some level you'll be held accountable for those issues because you're the one that's doing the evaluation, that's identifying here's where the issues are. Okay? You will also, so on some level, you can end up being ostracized from that organization if things are not going well and you're the one that's there reminding everybody, hey, guess what, we're not doing this well, we need to be doing this, blah 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 blah, that kind of thing. You may, as with anybody, you may have other people who are undermining that person in terms of what it is that they're doing, or talking about, the results, and that person, they don't know what they're talking about. Oh, they've got an axe to grind against me, and they're just out to get me, and that's why, and so on and so forth. The other part, too, is it just adds more work for that person, So if they're expected to do the evaluation and then some other things, that can be a lot more burdensome for them. So internal evaluation is good, particularly when you don't have a lot of money. Okay? And you can just say to somebody, oh, by the way, here's your new other duties as assigned. But just know that sometimes, particularly for that person, it can be a little bit lonely because people get mad at them. You know, like if they're having to say, hey, we didn't meet our numbers this month, you know, it's not their fault. The organization or the program didn't meet their numbers. They just happen to be the ones who are presenting that. So just be aware of that. So in terms of external evaluators, so bringing somebody either from outside of the program, outside of the department, outside of the organization to come in, there are some advantages. So a lot of times they can be more objective and they can have that fresh outlook. So in a lot of cases, you know, they don't have a horse in the race, you know, as people like to say. So they're just like, you know, hey, I'm just here to figure out what's going on and to report back. I'm not trying to, you know, take sides or anything like that. So they can tend to be more objective. They can also ensure that you've got unbiased evaluation outcomes. Okay, because they don't have a horse in the race, and they get paid regardless of whether the program is doing well or not, they can give you kind of an unbiased report of this is what's going on. And sometimes, you know, depending upon what's going on in the organization, that's what you need. They can also bring a more global knowledge, so they have knowledge about, in some cases, what your organization is doing, but how other organizations doing similar work might be doing. Okay? Which is important to know because, you know, sometimes you get in your organization or in your program and you're so focused on what it is that you're doing that you're like, oh my God, you know, we're having all kinds of issues, or oh, we're really great. And not really thinking about in the big scheme of things, like we did with our attendance benchmarks. We were thinking, oh my God, we're doing really bad. You know, we're like at 65% and they want us, you know, at 70, and you know, we just don't know how we're gonna do that, and blah 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 blah. You know, but then in talking with essentially the external evaluator, the people that was keeping the track of the data, they were like, oh, everybody's having these issues, you know, so it kind of gives you a little bit more perspective. You know, and you can talk, that external evaluator can talk about, in some cases, here's what you guys are experiencing, here's what other people are experiencing, and here's how they're addressing that. So it gives you that different perspective of what's going on. And typically, you know, because evaluation is what they do, and that's their primary job, they bring more breadth and depth in terms of technical expertise. So they, you know, have more skills and more expertise in terms of doing the data collection, doing the data analysis, so on and so forth, that, you know, your organization may not have. And so it makes it easier. The challenge becomes is external evaluators can be expensive. Okay? And when I'm talking expensive, I have seen external evaluators who consult at $200+ an hour plus. Okay? That can be expensive, you know? So you've got to then figure out, what can we afford. Like if we want somebody to do our entire evaluation, so our data collection, our data analysis, writing up the report, etc., you get into $200 an hour for 200 hours of work, which is like 5 weeks of work essentially. If you're doing 40 hours a week, now you're looking at $40,000. That's a lot, especially if you're a small community-based organization. You don't have that. Okay. The other thought too behind it is if you can only spend 10%, 20% of your budget on your total budget on evaluation, then if you have a $500,000 project, 10% is only $50,000. So you've got to be very clear on what it is that you're getting for that money. Okay? Another thing with external evaluators is do a contract and be very clear about what it is that you want this person to do. Okay? Don't just say come in and do an evaluation for me. Because some people, when you say do the evaluation for me, that doesn't say write the evaluation report too. And so now now you might have to pay in addition to get the evaluation report back. So think through, like what is it exactly that you want this person to do? If you want them to do everything, that's great. And maybe it's not an individual, maybe it's an evaluation organization. Okay? I can tell you probably one of the cheaper ways of going about getting an external evaluator is contacting a faculty member at a university who does evaluation and has students who need capstone experiences. Okay? And I'm not saying that, like in a bad way. I mean, because think about it. The student gets what they need. They get their capstone experience out of it. The organization gets what they need. They get their evaluation done. But it's also it may not be as expensive. Okay? So I was just having a conversation with somebody the other day about, like some organizations here in town really should be hiring GAs to do their work, some of their work. So like you could hire a doctoral GA to do be your external evaluator. They have access to faculty. They have access to SPSS and other resources and things like that. And you only have to pay them $35,000 total, $40,000 total you could get them for a calendar year. Okay? That includes salary and tuition fees, insurance, fringe, all of that. I mean, that's a good deal as opposed to 200 hours at $200 an hour, and you may not get everything that you need. And it may be somebody who doesn't have the expertise or speak the language that you need spoken. Okay? Meaning that, we've talked early on in the semester about, like that kind of that short-term evaluation, how some people call that outcome, some people call that impact. Well, if you're not speaking that same language, then you're not going to get what you need. So, making sure that, somebody that speaks your language and can read and understand what it is that you need, working with a university partner helps you get that. And if you had to pay for it, using a graduate assistant, and you can, you can then dictate your terms. Is this a master's level, a doctoral level? If it's a doctoral level, if you can throw in a dissertation on top of that, man, right, Joanna? Students would jump because they would know, hey, this is going to be funded for 3-4 years, and I'm going to get my dissertation. I don't have to worry about, insurance, my tuition's paid, blah, 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 blah. Even for you guys as master's students, you would jump at an opportunity like that. So think about that. In some cases, you want to do maybe some kind of combination of internal and external. So maybe it's bringing in an external evaluator who helps you plan your evaluation and what it is that you're going to do, and they maybe train your staff to do the evaluation, and then your staff does the actual evaluation. Okay? Sometimes it's going to be that you need that external piece. Okay? So you'll see sometimes if we want to look at funding, for example, and money and how money is being spent, there's that external audit that comes in and that looks at all of that. Versus some of the rest of that stuff can be done internally within the organization. So it's really just kind of thinking about, does your organization have the expertise to do what needs to be done and the knowledge and the time to do it? Or do you need to bring in somebody else? And then being very definitive about, we want you to write our evaluation plan and show us how to do it so that we can do it. Or do you want them to do everything? Or, kind of what is that mix in between and stuff like that. Well, I guess I'm thinking have I ever worked with an external evaluator? And yes. And a lot of times when you're working with the feds, so when we did this teen pregnancy prevention project, we uploaded all of our data to the Research Triangle Institute, RTI.org, and then they ran all the data and all the reports and, reported back on issues. We reported some, issues specific to our project, but so we were able, for example, when we looked at implementation of the intervention, we had those fidelity monitoring logs that said, did you do this activity, that activity, did you give this handout, so on and so forth. But all we reported to the feds was, yes, the intervention was implemented with fidelity, or no, it wasn't implemented with fidelity. We didn't actually report any issues that we had, but we had that information, so if we had issues with fidelity, then we could do a report for the feds for that. So we also participated in a cost-benefit analysis for the feds. So we had to answer questions about, how many staff were doing this, how many people, how much money was being spent, how much time was being spent, so on and so forth. So, in those cases, it was, it was an external thing. It wasn't us internally. We didn't have to do cost-benefit analysis. I had, as the PI, had to give permission to sponsor programs to release our expenditure information. So you may be in situations like that where the feds are doing more of a cross-site, cross-funding, kind of evaluation. So you will be working with external evaluators on that bigger piece if you're the PI, okay? If you aren't the PI, if you're the one that's just teaching the classes and implementing the intervention, you may not even deal with that external evaluation. So it really just kind of depends on where you fall in the food chain, kind of thing. So, yeah, thinking about all of that, a lot of cases you will probably be your evaluator. In some cases, and particularly like when you get into larger levels of funding, so if you're talking like $1 million+ a year, in some cases you will be required to bring in external evaluators. Okay? Just know that if you're asking for $200 an hour or more, okay, and trust me, I've seen like $350 an hour plus. Just know that you may hit that mark of, only 10% of the overall budget can be used for evaluation. So, you're going to have to, if you're coming in as the external evaluator, you may have to think, okay, look, if they can only pay me for 100 hours, what can I do in those 100 hours? And so you may have to do that negotiation as well. Okay? Any questions about that? It should kind of fit within what you have to write for your evaluation plan, so hopefully that answers any questions that you might have. If you have any other questions, remember next week is the last week we're meeting in person as a class. So I guess that means we'll need to talk about your second exam and when that'll be open, and I can give you some ideas of what's going to be on that second exam. But it'll be just like the first one. It is not, let me just say, it's not cumulative, okay? It's, yes, it is not cumulative. It only covers the second part of the class, okay? All right then. Well, I will see you all next week.